To order this roundtable. This is a public oversight roundtable of the Committee on Aging and Community Affairs. I'm Council Member Yvette Alexander. I represent Ward 7 and I also chair this committee. Today is Wednesday, July 14th, 2010. The time is approximately 2:10 p.m. and we are in room 123 of the John A. Wilson building. The purpose of today's public roundtable is to discuss the June 30th, 2010 report prepared by the Mayor's Office of Gay, Lesbian, Bisexual, and Transgender Affairs. According to the executive summary of the report, its purpose is to present data from the District of Columbia's Behavioral Risk Factor Surveillance System surveys and prompt discussion about how to improve the health outcomes in the GLBT community. The committee, however, received complaints from various organizations that were troubled by the report's omission of the existing research on the nation's capital transgender communities. And we were concerned that the report fails to acknowledge the current state of the district's transgendered communities.
Madam Chair, members of the council, good afternoon. My name is Sophie Jury. I'm an intern at the DC Center for the LGBT community. We're a nonprofit organization that celebrate and support LGBT residents and organizations in the Metro DC area. As you know, I'm here today to comment on the LGB report released by the Mayor's Office of GLBT Affairs. Although incomplete, the release of this report is an important step forward for our community. It documents a number of health issues that disproportionately impact our community, and it is our great hope that this report will shine a light on issues like tobacco use, alcohol use, and mental health issues in the LGBT community, as well as encourage the District of Columbia to allocate resources to address these issues. Still, the report does not estimate the transgender population's health need, nor does it single out the most pressing issues with which it is faced. And yet, in 2000, the Washington Transgender Needs Assessment Survey reported that the transgender community was a population particularly at risk for contracting HIV/AIDS, with an overall rate of 25% of the respondents living with HIV, a number reaching 32% for trans women. Up-to-date data collection is necessary in order to direct public efforts accordingly, and it will also be a critical asset in evaluating the progress of public policies over time.
The number one challenge that we have even to this point is the access to care. There's a lot of agencies, and I will say local agencies, that are in charge of promoting the health of the DC residents that really don't understand or do not want to understand that we are real people. There's still that stigma that when you go even to advocate for funds, they still don't want to hear it. So that translates in very limited or no funding at all for initiatives that are related to working with our population.
Our final recommendation is one that speaks to respect and dignity. Moving forward, we kindly request a commitment on behalf of the Office of GLBT Affairs to authentically improve and include trans-specific research in all future studies. It simply isn't excusable that our constituents are still excluded in these reports. For example, last November, the mayor released a biased crimes report that excluded trans people. The LGB health report is simply more of the same exclusion. We remind the mayor that the district's Human Rights Act includes gender identity and expression protections that apply to the government itself. The time has arrived for a real commitment to release studies inclusive of all LGB and trans communities. Anything less would be a complete invalidation of our communities, our lives, and our experiences. In closing, the failure to report data on the current health of trans communities underscores the urgency to introduce improved data collection methods, which will enable the council and the mayor to more effectively gather evidence and develop programs and services that specifically meet the needs of our constituents. We are pleased to have the opportunity to speak with you today and to discuss our recommendations in more depth. With the right leadership, we are confident that the District of Columbia can begin to more accurately collect data for the empowerment of all trans communities living in DC. We look forward to working in partnership with you all to accomplish these very realistic and achievable goals, and we appreciate your continued leadership on important issues impacting the district's trans communities. Thank you.
Thank you,
And
Mr. Perry. Just to go off in a minute for what Brian Watson, I have these revelations, and I get what you were saying about gender identity and sexual identity now, okay? Now I get it more. I'm always thinking, I'm multitasking up here. So I get it. Because now I'm just going to use you as an example. If you're a transgendered man or woman, that's your gender identity, but your sexual identity, you could still like a woman, or you could still like a man, or you could like a woman.
Yes.
So I got it.
Thank you for allowing me to present information concerning the report on gay, lesbian, and bisexual health that our office recently released with the Department of Health. The purpose of this historic report is to present data from the District of Columbia's Behavioral Risk Factor Surveillance, or BRFIS, surveys, and promote discussions about improving health outcomes in the GLBT community in Washington, D.C. The district uses several tools to collect public health data. One of those tools is BRFIS, which is an annual telephone survey that's mandated by the Centers for Disease Control. BRFIS surveys include questions related to behaviors that are associated with preventable chronic diseases, injuries, and infectious diseases. In addition to the mandated questions, states are given the option of adding questions to the survey. In 2005 and 2007, the District of Columbia was one of the few jurisdictions who opted to add questions about sexual orientation, making us a pioneer in GLBT data collection. With the publication of this report, the district joins Massachusetts, New Mexico, and King County, Seattle, as the only jurisdictions in the country to release a report that analyzes BRFIS data, and one of 6 jurisdictions to release a GLB-specific health report. The inclusions of questions about sexual orientation allows the district to see if health disparities exist between GLB and non-GLBT respondents. Our first report aims to be not the end, but the beginning of a fair, balanced, and enlightened process of addressing emerging issues in public health policy as it relates to GLBT people in the district. We'll continue conversations with community members, policymakers, and healthcare providers around developing strategies to improve health outcomes and data collection yielding policy and practice recommendations.
Now, what was your input in this report, the June 30th report?
The June 30th report, I drafted it and worked with the Department of Health to look at the 2005 and 2007 data results and produce a report.
So you drafted this report?
Yes.
And you didn't feel to reach out to the transgender community?
No.
Why?
I wish I could. I don't know. And when we worked on these reports, it was an internal work within the Department of Health and within our office.
Could you repeat the name of your office?
The Office of Gay, Lesbian, Bisexual, and Gendered Affairs.
And for transgender, you don't know why you didn't include them?
Well, I don't know what I don't know is why we didn't reach out to specific organizations in the drafting and review of this report. We chose not to do that.
The transgender community was not too happy about you in this position, but they gave you their support. So they expected the commitments that you made to their community, you would hold up to your end of the bargain.
Right.
And thus far, they don't feel you have in terms of the transgender community.
Okay.
So I would say you have to do better, or, people's voices will be heard.